U.S. Senator Bill Cassidy is joining us this morning. Good morning to you, sir. First, I know you want to send your prayers and ask for your constituents to pray for your friend John McCain, correct?
Totally. John McCain, what a great American who has dedicated his life to the service of our country. Keep him in your prayers. They're describing it as a very aggressive tumor. We want the best for John. We want the best for all Americans, but he is just someone who's just dedicated himself, Aaron, to serving our country. And so many people in the Arklatex region have served in the military and can totally relate to his experiences. So anyway, just to say that, thank you for that.
You bet. You, I'm sure, were in the meeting with the president. He called the senators to a big meeting. What did you hear from him? Any surprises?
No, the president wants to get things done. So do I. So I've been working with the White House now for 2 or 3 weeks now, trying to come up with something which will get all the way through. That is a conservative Republican solution that takes care of taxpayers, takes care of patients. Rode home last night with Tom Price. And so anyway, who is the Secretary of HHS. So we're going to get there. We're working hard. I'm with the president. We want to make sure it happens, and we're working that way.
Would you be in support of a bill that would just repeal Obamacare, I guess take us back to what we were at before, while you guys spend the next couple of years working on a better replacement plan?
The president made it very clear yesterday he wants to replace. He could not have been more clear that he wants a replace bill. So that's why I'm working with the White House to make sure it happens. But again, we don't want to trim around the edges of Obamacare. We actually want to replace. And so I think that's the marching orders he's given.
You have your own plan. You've been working on this for a long time. Why is your plan not taking hold? No traction at this point.
No, that's not right, Aaron.
Okay, good.
About all the plans out there are somehow centered around my plan. So, for example, the Medicaid reforms are all related to something I wrote. Ted Cruz's amendment, which is a good amendment, allowing folks to use their health savings accounts to buy premiums, to pay for premiums for health insurance, is actually part of our original plan, which, now Ted's taken, and I'm all for it. So, and the idea of block grants, which is very much part of our plans, and is a plan I'm currently working on, seeing if that would work, again, working with the White House. That's my plan. So I feel like I've been able to take the wisdom of Louisiana and channel it into public policy, and our country and our state will be better.
What is the sticking point of those couple of Republicans who continue to say they're not going to support this plan or that plan that the GOP is putting forward? What's their big issue?
Different people have different reasons. One person is very disturbed by the way the process has gone, feeling that it should have been through a normal committee process. Frankly, Democrats are not going to help, but it's still important that we have witnesses, that people who complain give a chance to complain, people who praise a chance to praise, and just for the sake of the institution, they're concerned. I think we as Americans can respect that, and I don't defend the process at all.
Supposed to take your break in mid-August. Do you anticipate y'all will probably have to work through August?
There's nothing like a deadline to sharpen a man's mind. I'll just say that, or a woman's mind. So deadlines work. I always like being in Louisiana because I get to have town hall meetings, and I get to hear from folks back home. And obviously I have a lot of town hall meetings. We've started to cancel them for August just because we might be here. So if we're here, and I'll do work. And if we're not here, I'll be back in Louisiana, and I'll be meeting my constituents. Either way, I think it'll be a good August for me.
In the session with the president, did you guys get any marching orders about, the plans we've put forward are not what everybody wants to support, so let's kind of scrap those and start over? Or are you kind of trying to piece different plans together now and kind of put a different package together? What's the direction?
The president, the only real marching order he gave is he thought there should be a replace with repeal. And I guess the second marching order, he wanted to get us done. Now, what I've been working on is something called a block grant. And first worked on with Susan Collins from Maine, now with Senator Lindsey Graham from South Carolina. And in this, we give the power back to the patient and back to the state. We take the money the federal government would spend, and we give it to the state with guidelines. You have to use it for health care. But if you think about it, Louisiana is different than Alaska, which is different from Rhode Island. And so the idea of Obamacare, that somebody out of Washington, D.C. could come up with a system that works in every state, was ludicrous. But the idea that you give the patient the power, give her the choice of which insurance company to purchase from, give the state the power, is founded in our Constitution. And so we're going back to a plan, at least what Lindsey Graham and I are working on, but we think we're getting traction, would be to give that power to the patient, to the state, block grant the money to the state.
What about the taxes on the wealthy that's been included and they've left those in? Any movement on that?
No, I think right now all the plans out there would keep those. The president didn't even mention them. So, in fact, he kind of, if you will, praised the idea that the plan as going forward, praised it as it was, and he said he wanted to add even more money to it. So if you're a fiscal conservative, you got to pay for things. You hate taxes, but you still got to pay for things. So the fact that the president wants to add more money, I guess he's kind of implying that he's okay with those. The
other question, and Robert talks about this a lot, and I know he would be begging me to ask you this. If the states get their money and they do what they, whatever they want to set up in their state, when the plan in California fails and flounders, will we then have to step in and pick up the tab? That's what a lot of us worry. Yeah, that's great, but California wants to keep this wacky plan, then we're going to have to come foot the bill later.
Absolutely not. Each state would receive their fair share and would not get bailed out by other states. And that's the beauty of the plan. In fact, some folks have criticized my previous plan, suggesting that's the case. They just didn't read my plan, because we're very, very clear. Each state gets their fair share, and you live on it. If you don't do right, well, then your state taxpayers have to pony up.
We hear these numbers now. This morning we are hearing 32 million more Americans will be without care. We've heard the 20 million figure. What do we hope to do about that? I mean, we want people to get health insurance, those that need it. We want people to get health care. But then you hear these big numbers about, people are going to die, et cetera. How do you address those concerns?
So by understanding, so that latest report does not have a replace attached to it. Mm-hmm. That is only a repeal without a replace. And maybe that's the reason why President Trump emphasized so much that he wanted a replace. So first you have to say that. Secondly, the second thing you have to say is that the Congressional Budget Office that does all this scoring, they really believe in the individual mandate, which is that if you don't purchase insurance, you get fined by the federal government. Turns out like 50% of the people paying that fine have a taxable income of less than $25,000 a year. So think about it. We are fining people making less than $25,000 a year because they're not purchasing insurance. When President Trump ran, when I ran, we both said we wanted to get rid of the mandate that an individual had to buy insurance or else she gets fined. So I think that you're going to have a few more people uninsured because under the president's kind of mandate from the people, he's supposed to get rid of the mandates on the people. And the Congressional Budget Office just doesn't like that.
The costs that were spiraling out of control, will the measure you hope to put in place, will that rein that in for the average American who is listening to you today, who is paying way more money than we ever did? I know you have to have a message for those folks.
Yeah, so one thing we've been really working on is something called price transparency, which when the doctor orders a test on you, you know the cost of that test before you go in. You don't find out 6 months later. Just an article down in the New Orleans newspaper, a woman got blood tests ordered, just had them run, cost her $324. She found later she could have had them done the exact same test down the street for $30. So if you have price transparency, then the consumer just scans a barcode. Oh, you ordered these tests on me. This is where I can get it right now for this price. Then you would go for that cheaper price, assuming the same quality. That drives down costs. And we're going to fight to get price transparency out there so that somebody purchasing a good or service in the healthcare arena knows their price beforehand, not later.
Senator Bill Cassidy, thank you so much for your time. I'm seeing you on all the national networks. You're looking good.
We're working it, Aaron. We are working it. Thank you very much for having me.
You bet. Take care.